My mistake. I really want to see that stop, and I don't want to see families and individuals go through the guilt and the distress and see loved ones impacted by what is, as Dr. Chance says every day, a very serious illness. So can I please get that message out as strongly as I can? I also know this week there will be special celebrations around Al-Adha, and I just ask families to please know, as hard as it is, I mean, I haven't seen my parents for a month, and I know that's very small compared to what a lot of families are going through. But I just ask everybody to please think about their loved ones. You might think you're doing the right thing, but we just need families to stay in their family home and not move from household to household, because unfortunately too many people are getting sick from that. And the second highest example of transfer of the virus at this stage is in workplaces. That's why we've put those rules around workplaces in particular. That's why we've had to ask some businesses to down tools until July 30, because workplaces unfortunately not only spread the virus to colleagues but potentially spread the virus to other communities, because people from different areas are coming together at a workplace. And now some of these workplaces have been workplaces where people need to go to. And fortunately, we haven't seen a huge transfer to patrons, but definitely through work colleagues. So please, if we can just stress, be extra careful in relation to workplaces and also in relation to your own family members who don't live in your household. These are two areas we really need to focus on. And I'm convinced if we work together, we will see that number go down. We won't see the effect of the harsher, even though we've been in hard lockdown, we won't see the effect of the harsher restrictions for another 4 or 5 days. But I know they're there to be had if all of us stick together and work hard. And I also wanted to stress today that if you've been impacted in the last 3 weeks or in the last few days by decisions the government has made in relation to your personal work situation or your business, please know the help is there. So please know, if you're an individual, go through Services Australia to get those disaster payments, those immediate payments that come to you. And please go to Service New South Wales, and we understand there have been tens of thousands of people already on the phones this morning, and we ask for your patience. But if you're a business, please go to Service New South Wales to get the assistance you need to get those grants coming through. We know this is a difficult time for so many. We know that. All of us are in this together, and I just ask everybody to stick with it and to be as patient as you can. But please know, no matter what you're going through, there is help for you. And no matter what you're going through, chances are there are other people in our community going through the same stresses. I know New South Wales is up for the task.
For use in children, and I know the regulator, the TGA, is continually considering the vaccine. At the moment, we have a shortage of supply of the vaccine, but we do have adequate supplies of AstraZeneca vaccine, and I'm just urging our population coverage, even for the over 60s, is not high enough, and we have a good vaccine that can be used where the risk of hospitalisation and death is very high as age increases. It is present across all age groups, so I just would urge people to go out and access AstraZeneca vaccine and go and have that discussion with your doctor. Obviously, the Delta strain transmissibility will make us have to rethink about the level of vaccination, and I think I'm alluding to the fact or probably stating it clearly, that I think having vaccines available
children would get access to the vaccine, and would you anticipate that, say,
serious as our messaging to the community in a 1 in 100 year pandemic, that clearly someone somewhere in the system was feeling the need to disclose those figures to somebody who was not an appropriate person to be making commentary about it. I'm coming to you, Liz, just wait. And so Health looked at the issues around that, I saw someone saying in the social media that there was a sting. No, there wasn't. It was just looking at what the issues were and making sure that the system was such that that information could be kept to the appropriate time. I must say, one of the ministers today, we come out with a decision, and it's a cabinet decision, and I back our
Well, the weekend has seen the New South Wales Premier throw her old trusty COVID guidebook out the window. What New South Wales is facing from tomorrow is more like a Dan Andrews Victorian lockdown. It comes in 3 tranches. The Premier has placed a ring of steel, as they call it, around the 3 southwestern Sydney hotspots, the local government areas of Fairfield, Liverpool and Canterbury Bankstown. Now, I hate lockdowns, and even the World Health Organisation is now advising against them. But given the data, there's clearly a lack of compliance occurring inside those 3 areas. Even today, with 105 new cases recorded, 75% are from southwestern Sydney. There continues to be a drastic lack of compliance, with 27 cases active in the community whilst infectious as well. So the majority will probably understand the merit in shutting those 3 areas, at least for the short term. It's an area with a high concentration of blue-collar workers, many of whom have more than one job and need to travel across Sydney often for that work. Dividing retail into separate critical and non-critical categories will make sense to those calling for harder measures. Thankfully, non-critical retail operators can remain open, but only for click and collect, takeaway and home delivery purchases. But what I can't fathom, and neither could several members of the New South Wales Cabinet, is the decision to shut down the entire construction industry. That's $1.4 billion per week.
I'm not embarrassed to say that in public life, yesterday was probably the most difficult day I've had personally, because we don't take these decisions lightly. They're decisions that affect lives and livelihoods. They're decisions that affect millions of people. But my job and the job of our government is to keep people safe, to reduce transmission, to reduce the risk. And I again accept it's not an exact science, but please know we rely on the best health advice available. We have the best teams, I believe, in our nation.
I do hope we're relying on financial advice as well as health advice when we make those decisions. A difficult day for Gladys, nowhere near as difficult as it will be for tradies and construction workers who will down tools from tomorrow. And there'll be a rush on federal and state assistance tomorrow morning like public servants have never seen. 90% of the major construction projects in Sydney are outdoors. And we know that in New South Wales there has been no transmission outdoors. Even tradesmen and women are doing their best in following all the COVID-safe rules, masks, gloves and social distancing from customers. I've seen it firsthand. At the very least, just as she did with retail, cutting it into 2 sections, the critical and non-critical, why wouldn't you have separated construction into indoor and outdoor categories? As we've been reporting here on Sky News through the day, several key New South Wales Cabinet ministers argued against shutting down all construction, but they were overruled by the New South Wales Premier.
We also have to appreciate, unfortunately, that the sheer mobility of thousands and thousands of people going to multiple sites, small, large or medium, is unfortunately a very big risk at this time. The large government projects are not happening because, as painful as it is, we can afford to put a pause on them for 2 weeks, and we wanted to make sure, we are putting the same standards to ourselves as we're expecting from the private sector and the smaller business communities. And we appreciate the significant burden it has.
Don't you love it when politicians say we're putting the same standards on ourselves as we would the community? Well, how about the loss of jobs? How about people getting a whack off their wages and copping the downturn in income? Well, sorry, that has not been shared by public servants or politicians. Anyway, there you have it. It's a Dan Andrews style lockdown in New South Wales until at least July 30 and no doubt beyond. Let's hope that similarity ends there and that the New South Wales doesn't take 112 days to make a difference.